Right, we can get started. Good afternoon, folks. Welcome back to our seminar series on different exciting topics to see how AI and data, the innovations and impact it can have on various societal applications, which has been the theme of several of the seminars, especially from the AI and society class as well. So today, it's really a pleasure to host Dr. Professor Sam Scarpino from Northeastern University, where he's the Director of AI and Life Sciences within the Informational Institute of AI. He's also Professor of Practice in the College of Health Sciences and the College of Computing. But, like Sam's career has been, as we think about how do we do research and translate it, there's very few folks that I know and I deeply regard who have walked that journey and not only innovating and publishing at top places, and also translating them from a variety of applications from public health, medicine, etc. Prior to coming to Northeastern, Sam was, the Vice President of Pathogen Surveillance at the Rockefeller Foundation, Chief Strategy Officer at Pharma Platform, which is a social impact technology startup, and also co-founded a data science initiative called Global Health, which was backed by Google and the Rockefeller Foundation. And as I said, he's developed his research has led to business supported tools, public health medicine, real estate, finance, etc. And even during the COVID times, his work was instrumental in informing the national standard. And so this clearly is a very strong translational element. And the evidence of that is he's given, his papers are highly cited, more than 8,000 citations. He's given over 500 interviews to some of the top news media in print or in TV or cable news, as you may see fit. So clearly, Sam, so thank you again for sharing your perspectives with us today and talking to us about good data saves lives. But what are good data? I appreciate the plurality. What are good data? What is good data? So I do appreciate that. And he's also a fellow of ISI Foundation in recognition of his work with complex systems. So, Sam, thank you.
Thanks so much for having me. It's been such a pleasure being here today. I was telling a bunch of people that while I was at the Rockefeller Foundation, I really only missed two parts of academia, like missed them a lot. One was working with the PhD students, and two was getting to show up at places like Notre Dame and talk to all of you about your science and tell you about what I'm working on. And I've known Alex Perkins for a while, but got to meet a whole bunch of people who I had not met before, but we share a lot of similar interests. So thank you all very much for all of the wonderful meetings today, and thank you for all the help with the coordination. So what I'm going to do today is talk about a little bit about what I think I mean by good data. I'll show you some examples of how I think that matters from COVID. The meat of the talk is actually a paper we published trying to study how predictable infectious disease outbreaks are from an information theoretic perspective. And then I'll end with like a short soapbox about where I think we need to go. There we go. Okay, so just very briefly, I came back to Northeastern 18 months ago as a part of an initiative, the Institute for Experiential AI. Osama Fayyad is our executive director. Osama has a very interesting background for someone who's in academia now, which is that he did a PhD in computer science at the University of Michigan, but has spent most of his career outside of the academy, places like Yahoo. This was back when Yahoo was like bigger than Google, and especially on the research side of things, a chief data officer at Barclays. And we have hired now around 20 research scientists that are focused on core areas of artificial intelligence, life sciences, health and climate, sustainability, responsible AI. And we're really looking to bring the AI practice at the university into tight interface with industry partners, with government, with nonprofits. So this word experiential means a few different things to us. One is training the next generation of decision makers who will use AI as a part of their decision process, acknowledging from the beginning, and this will be a theme kind of throughout the talk, that with current AI technology and sort of anything that's on the horizon, the humans are always going to need to be in the loop. And so we want to be very intentional about how we engineer and deploy systems that have humans or wet labs, if you're a biologist like I am, in the loop. And then the third thing it means is this interface with industry partners that we kind of call use-inspired research. I direct the focus on AI and life sciences, which right now has about 15 people. So we have 4 full-time research scientists who are working on a variety of things from computational drug discovery, analysis of single-cell multi-omic data, drug discovery, protein folding, et cetera. We're trying not to boil the ocean when it comes to AI and life sciences. And so the kind of focus areas that we have are around drug discovery, around analysis and integration of multi-omic data, and then the area that I'm primarily focused on, which is public health and infectious disease epidemiology. So why AI and life sciences? I think there are 2 kind of easy-ish answers. The first is, if we think about how we go from the underlying genetic code to the phenotypes that we care about, whether those phenotypes are diabetes or height, you move through this process of the genome, the transcriptome, the proteome, the metabolome, all of them interacting with each other and interacting with the environment to give rise to the phenotype. There's some kind of unknown nonlinear relationship between all of these different layers. And that's something that artificial intelligence is very good at. There are a lot of things that AI is not very good at. Modeling nonlinear relationships between densely connected systems is something that AI is pretty good at, all things considered. And so we see this as a significant opportunity to make major advances in our understanding of living systems. The second piece is a lot more practical, which is a lot of our analytic tools, like coming from bioinformatics, don't scale to modern data set size. So if we want to do something like take 500,000 SARS-CoV-2 genomes, which are not particularly large as genomes go, and build a model to predict their sampling location. So I give you a new genome and I want to know where it came from. You could do that by building a phylogenetic tree, but with 500,000 genomes, with most of the established procedures, that's going to be days or weeks or months on the supercomputer, and it's probably going to crash before it ends up working. We can do this with neural networks on Juan He's computer, who's a PhD student that leads this work basically on a laptop with a little bit of cloud support. So we think the 2 kind of most obvious opportunities are building these nonlinear relationships, these maps between different layers of the ohm, but back with the environment as well, and then developing tools and algorithms that scale to modern data set size. Okay, so to kind of ground us in what do I mean by good data, I want to just think for a few minutes about this question about where the next pandemic is going to emerge. Probably some of you are thinking about whether it's going to be in the United States with dairy cows and H5N1 right now. To be a little bit more specific, we might focus on where the next influenza pandemic is going to emerge. And prior to 2009, we would have been laser focused on a data set that looked like this. So these are reports of avian influenza in wild and domesticated bird populations. And we know that birds harbor most of the genotypic and phenotypic diversity of flu. So this is a great place to think about doing surveillance. Does anybody know what the big issue is with this data set as it pertains to 2009 H1N1? How many of you would consider yourself some kind of Bayesian? Everybody should put their hands up because you're all Bayesians, whether you believe it or not. That's how the brain works. Where did the 2009 H1N1 pandemic start? Mexico. Is Mexico on this map? No. So if we're going to build a model of the emergence of avian influenza, we don't even have the right answer in our prior distribution. And there's not a whole lot that we can guarantee to be true, but one of the things we know is true is if you don't have the right answer in the prior, you're not going to find it. We actually know a lot about how influenza emerges, and it's not just as simple as bird flu spilling over into humans. We understand a lot about the biology of the transition between an avian type flu and a human type flu. And we know that, for example, pigs are a really important evolutionary intermediary between spreading efficiently in birds versus spreading efficiently in humans. We also know that if it's going to be a pandemic, it has to move. So we've got to have information on airline travel, on behavioral patterns, on local mobility, how people are responding. All of these different pieces of data are going to impact the probability of a pandemic emerging. And so if we just now start to incorporate other pieces of data, like the density of hog farms, and we zoom in on the central region of Mexico, that's for sure going to be in the top 10 places on the planet. And so we're immediately doing better, which is that we at least have the right answer in the data set now, but we actually have the right answer kind of percolating up towards the top of the places where we should be paying attention. For those of you that work, if you work on influenza, this part of the US, let's see if I can get this to work. There we go. This part of the US here, there's novel swine flus that spill over into human populations pretty much every year, mainly people that do 4-H. Like if they're taking pigs to the state fairs, they spend a lot of time in close proximity with the pigs. Some of them end up with some novel flu. It doesn't end up causing a pandemic, but we know that this kind of thing is important. And one of the pieces that we don't spend enough time doing is leveraging our mechanistic knowledge of biology when we think about public health policy. However, there's another issue, and this is where I think artificial intelligence has to play a role if we're going to be successful, which is a lot of the answers for this kind of stuff, for this pandemic risk, is sitting out in the literature. We're just not able to curate it. During the pandemic, I think it was every 6 minutes, there was a paper published with SARS-CoV-2 or COVID-19 in the title for 2 years. You obviously can't keep up with that volume of information. For other things like CRISPR, it was every 15 or 20 minutes. So it was definitely a COVID thing where, I mean, it was literally everybody publishing on COVID, but there was still an overwhelming amount of information on just about everything else coming out in the literature. So we were surprised by the Ebola epidemic in 2013. Nobody really thought it was going to happen in these West African countries. They were paying attention to countries that had had it before, like Congo, Central African Republic, Rwanda. There's data going back to the 1980s where they ran sero surveys. These are data from Sierra Leone, I think, on age distribution of seropositivity for Lassa, Ebola, Marburg. And if you look, even though they're low, you do have non-zero percentage of individuals in these countries across all age groups that are seropositive for Ebola. Now, some of those are false positives. Probably a lot of those are people that were exposed in other countries and then moved in. But this idea that we had no way of prior knowledge around a set of countries that just emerged from decades of civil war amongst the least amount of public health and medical infrastructure per capita on the planet, who have evidence going back to the 80s of seropositivity for Ebola, this should have been way at the top of the list, right? We absolutely should not have been caught off guard where it took 3 or 4 months before we figured out that what we thought was Lassa fever was actually Ebola. And this keeps happening, right? So Zika virus, we had absolutely no idea about sexual transmission for Zika. You look back at the Yap Island outbreak and the ratio of female to men is 3-to-1. And there's no way to get that kind of gender bias unless you have something that's gender biased going on, like sexual transmission, or some other. And they put in the paper that it had to do with health-seeking behavior of women. And one of the things I always tell the grad students in my group is anytime somebody says anything that sounds like this large group of people does blank, you immediately go and try to figure that out because they're going to be wrong about it, right? And so this idea that a 3-to-1 gender bias is because of health-seeking behavior, they had no data to support that whatsoever. Like clearly that's going to be wrong. There probably is some element of that having to do with health-seeking behavior, but this is also pre-birth defects. SARS-CoV-2, a lot of the world was totally caught off guard. Again, everybody, including China and the countries in Southeast Asia, were caught off guard by the asymptomatic transmission and absolutely should not have been. Mpox, again, largely caught off guard by that. There are people in Western Africa, including Nigeria, who have been warning us about Mpox for 15 years now, and basically no preparedness went in. And now we're in a situation with dairy cows. Probably is not going to cause a pandemic, but dairy cows don't really have a long history of transmitting influenza to each other. And there's actually some mechanistic reasons why, having to do with compounds in the blood that prevent hemagglutination, et cetera. So we have this like super weird thing that's never happened before, and a lot of public health people telling us not to worry about it. And that's okay, we probably shouldn't worry about it, but we also need to admit the fact that like this is really weird and we have no idea why this is actually happening. And we should be a little bit more open and honest about the fact that like this doesn't fit. And so if it ends up being the case that we're caught off guard by another pandemic that sweeps out, we will have no excuses for what has happened. So it's also not true that there's very little evidence of transmission there's good data going back to the 60s that cows get bird flu and that milk volumes drop in dairy cows when they get sick with the bird flu. So this idea also, it took the dairy farmers a long time to figure out what was going on. This has been known since the 60s that this kind of thing happens. You get bird flu outbreak, milk volume drops, that's what's causing it. And it was weeks or months of infection in the cows before anybody put that together. Okay, so the rest of the talk, what do we mean by good data? What it mattered during COVID? Why data volume does not mean good data, and then briefly sort of what I think the path is going forward. Okay, so I spent a lot of time thinking about this question. And at one point, I tried to make it simpler by saying, okay, let's just forget about good data. Let's just see if we can come up with a definition of data and work from there. Does anybody have a definition that they want to share? We're at the Data Science Institute, nobody's going to share. Everybody's afraid. Yeah, in the back. Okay, quantitative or qualitative measure, that's great. Any other? So it ends up sort of depending whether you're a philosopher or a computer scientist. But if you're a philosopher, you probably end up saying it's some factual information. And as soon as you see the word fact, a whole thing becomes a mess, right? So in the sort of philosophy as it pertains to data, and this is true in Bayesian statistics, right? As soon as I say something's data and I plug it in, that is a fact. I might have some sampling process in my likelihood. I might have some way of accounting for noise. But as soon as I call it data and I throw it into that equation, I'm assuming that it's true. I have a part of the talk, a different talk that I'm not giving today, which is called Ground Truth in Biology ? And it's basically just a series of vignettes of there's no ground truth in biology and you have to pick something that matters to you and that's all you can do. We did a study of pediatric malaria in Nigeria where we had 5,000 individuals who were PCR tested, rapid tested, and given a clinical workup for malaria, and they all could not have disagreed with each other if we designed it that way. The PCR and the rapid test only agreed 40% of the time. So you're going to build an AI model to predict pediatric malaria. Is it going to be based off the clinical workup? Is it going to be based off of the rapid diagnostic test? Is it going to be based off the PCR? Is it going to be based off of blood smear microscopy? And importantly, they disagree with each other for mechanistic reasons. It's not stochasticity, right? So what was going on in the Nigeria case is that you had individuals with minimally or undertreated HIV, suppressed immune system, and low levels of replicating parasite inside of the blood that the PCR test picked up, but the antigen test didn't pick up because they didn't have symptomatic malaria. We know about 10% of malaria cases, PCR negative. You put them under the microscope and the parasite is swimming around happy as can be. You sequence the genome and the region the PCR test is looking for, boot it out. Because if you use PCR testing as a shield, you're placing incredibly strong selection pressure on the virus or bacteria or parasite to evade that selection. The second piece, and this one is the one that everybody likes because it's way easier, is just this information in digital form that can be transmitted or processed. And I'm largely going to focus on this piece for good data. So even if we set aside the fact business, okay, we're not going to be the philosophers, we're going to ignore this fact problem. We're just going to say it's digital information that can be processed and transmitted. Then all of a sudden, we've got to figure out how to collect it, store it, share it, do analytics on it, and translate it into impact. And it's very hard to get funded to do any of this stuff. Even as a startup, we were building offline medical record systems. It was a huge effort to try to raise money around, look, we just want to build a better collection and storage system. And they said, well, can you come up with any other way to describe that that sounds more exciting? And I said, no, because like that's the foundation of all of this, right? They can't be more exciting than that. However, I didn't come up with this. If you just Google like Maslow's hierarchy of data needs, you'll find like a whole bunch of these examples. Maslow stole this idea from Native American tribe in the United States and Canada. And as it often happens when you sort of take credit for somebody's ideas, that you make it worse than what their original idea was. And so the actual original hierarchy of needs that Maslow stole from the Blackfoot Nation was not a hierarchy. It was a circle, it was a loop, that all of these things are like interconnected with each other and you can't separate them out. It's kind of like what we call a complex system now. And so even this hierarchy of needs, this idea that like if I want to have impact, if I want to publish papers in science or I want to save lives, that rests on the analytics, it rests on the sharing and storage. It's not like a linear progression. It's some sort of complicated web of interdependency that is very challenging to manage from both a technological perspective and from sort of a sociological perspective in terms of how we share it and organize it and share credit for it. Another way to think about this, I took this from a book called The Data Revolution, and I simplified this a little bit. Another way to think about good data are just like to be real computer science people about this, which is like, what are the requirements? What's our rubric? And so we could have different levels, which is like level 1, which is data are not really machine readable. And this is an area where I think we've had a lot of progress in artificial intelligence. This is another really good application area. We're working with a bunch of we're calling it precision medicine groups, but these are groups that like run genomic tumor boards where they convene physicians to look at patient records and try and come up with alternative treatment protocols. A huge problem is that all the data basically get emailed and faxed and thrown as paper airplanes over, and figuring out how you actually digitize all that and move it into some kind of structured or semi-structured form so that you can start to query it and search it. That's a place where we've had huge advances in artificial intelligence. The second is it's machine readable, but it's trapped in some kind of proprietary format like Microsoft Excel. So like we can work with these kinds of data, but you got to have expensive software. It's going to change all of your gene names into dates. It's going to be a big disaster. And the vast majority of all of our data are trapped in these kind of two formats, right? And this is what most of the tech companies are lighting billions of dollars on fire to try to address, is that we have a lot of non-machine readable data and a lot of data that are not proprietary. However, and if I was going to work on a PhD thesis again, it would be related to the fourth part. We do have a lot of machine readable data that are in CSV format, but the problem is almost all of our machine readable data are not actually tagged with the right kinds of metadata and ontologies used to collect them. So we have the data, but we don't have the context around how it was collected. And that means that a lot of the level 3 data is just as worthless as a lot of the other data that we work with, because we don't understand how it was collected, the biases, inequities, et cetera, that went into it. And this, I think, is a place where there's a huge amount of opportunity on the artificial intelligence, on the data mining side, is not so much like extracting the data from non-machine readable and populating a data lake or a relational database, but instead actually trying to somehow infer meaning, right? So that like knowledge graph construction or ontology building, all of these places are where I think that there's a lot of opportunity and would really significantly advance the field when we make progress in these spaces. And so what we want to do is kind of go from a situation like we're in now, where you have a whole bunch of data, people who are benefiting potentially from health, community healthcare workers and healthcare providers, NGOs and governments and nonprofits, governments, et cetera, in this like mess that means the metadata don't track. We don't have enough information to actually build the models. We want to figure out how we somehow streamline this. But unfortunately, that requires technology and funding and organization and social systems and all of the things that many of you are working on. But it's very hard to get that sustainably financed. And it's very hard to get people's incentives aligned in such a way that we want to work on these kind of problems together. One like really poignant example of this, how many people have seen this study before? This is cell phones and fish prices in India. So what we're looking at here, this is the sale price of fish on the y-axis over time. And so you see it like whipping up and down. And the vertical bars are when the fishermen all got cell phones in that particular fishing. It's 3 different areas where they offload the fish. And so what is almost certainly happening is that I pull up to Alex and I say, I've got a bunch of fish. And Alex is like, it's $50 a pound. And then I call up somebody else and I was like, well, how much did Alex charge pay you? And they're like, well, he paid 55. And I was like, okay, well, I just talked to Kevin and Kevin said it's 55. So I want 55. And so all of a sudden you basically have the fishermen coordinating and the price stabilizes. Now, interestingly, some of the people who are probably better negotiators are making less money, because I'm guessing these fluctuations are not random. It probably is like heavily negotiator dependent. The problem with this study, this was like heralded as why information sharing is so beneficial and like could potentially change the landscape with respect to, smallhold fishermen and farmers, et cetera, is this did not translate into any other setting. Any other place where we've had the rollout of mobile phones like this, they have not found the same kind of result. And the hypothesis about why, it was published in this review paper recently, is that the extent to which the actual practice of mobile phone use among individuals in North Corrales Fishers is specified in the article, while the quantitative data that forms the substance of their argument is collected systematically, details on how the phones were used is sparse, and a lack of transparency about how insights were acquired. Some of these details are deprioritized to footnotes. This is broadly reflective of what counts as evidence in economic analyses. Collected prices are data, but details on process are background or explanatory and relegated. So what they're saying here is we think of the quantitative piece as the data. That's what's stored and made reproducible and tracked and put inside of databases and published. But all of the context and metadata around those, that's what actually matters for interpreting and trying to understand whether this is going to translate into other settings. That's what really matters from the artificial intelligence training side of things. That's what people are spending so much money and effort trying to understand. And right now, and this continues to this day, most of this stuff is relegated to the supplement or relegated to the dustbin, or it's never collected. So some examples of why this mattered during COVID-19. We did a study on mask mandates and whether masking influenced COVID transmission rates. So we ran this with SurveyMonkey. They just appended on to other surveys that people, and would you like to take a survey on COVID? And some people say yes. So there's obviously some biases that are here. This is just looking at the percentage of people that said they were willing to wear a mask across 400,000 representatives. One of the things that we found is, of course, it varies wildly by setting. At the time, a lot of people were wearing masks in grocery stores, but not at home. They were wearing masks in certain settings, but not other settings. We found a lot of evidence that more masking leads to less transmission. So this is the percent of respondents very likely to wear a mask around family. And so more masking is on the right. This is the measure of transmission as the instantaneous reproductive number. If you don't know what that means, it doesn't matter. Up is worse than down. And there's this consistent pattern, although it's very noisy, down and to the right. But when we asked whether this maps onto any kind of policy that was in place, the answer was absolutely not. So we say, okay, we've got all this variability across the United States in mask wearing. We know that that's linked to transmission. And then we say, okay, did anybody policies matter? And the answer is no. The answer was no. And why was this? So we did this segmented regression analysis of reported mask wearing, no statistically significant change in the slope after mandates are introduced anywhere in the US. And it's this beautiful natural experiment because they were implemented in different parts of the US at different times in different transmission regimes. We have lots of variability. At this point in time, it hadn't become too politicized yet. So the masking got politicized a little bit later than this. It was starting to, but you didn't really have these, like, people weren't burning masks and stuff back at this point in time. Everybody was wearing them on the airplanes, all this kind of thing. They found this in a paper about voluntary COVID vaccination. This is probably also what's happening for masking, which is that differentiates others in their beliefs about vaccination effectiveness, their trust in public institutions, and whether they perceived enforced vaccination as a restriction on their freedom is what explained the variability in vaccination. I'm sure that's what's also going on for mask wearing. Is if the people don't have the trust in public institutions, they will only comply for a short period of time while you have very strict enforcement. And as soon as it gets relaxed a little bit, or as soon as people get sufficiently fed up with it, if you don't continue to ramp up the enforcement, they just stop wearing it. And so it doesn't really have anything to do with the policies. It has to do with whether people trust the governments and the authorities that are putting the policies in place, and whether they feel like it's well aligned with their own costs associated with doing these sorts of things. And we see this with mobility data. So these are real-time mobility data around different parts of the United States. So the blue is Boston. That's where I was during most of the pandemic. The orange is Raleigh-Durham. The green, which you can't see, is the rest of the US. Cape, part of Florida is in yellow. And so a couple things to note is, see how this 100% is sort of an average over the last couple of years. So that's like normal mobility. This drop here, this occurred before any of the businesses got closed. So one of the things that happened during the pandemic, and this was like true everywhere, is as soon as people are worried about it, if they have the ability to stay home, they do it. They don't wait for the government to tell them it's time to stay home, right? People get scared, and if you can stay home, you stay home. If you can't stay home, you have to go to work throughout the whole period. One of the things in Boston, if we stratify this by time of day that they come into the city, there was no change for people that come into the city between sort of 5 and 7 o'clock in the morning. And those were some healthcare workers, but also a lot of like custodial staff, construction workers, people whose jobs got labeled as essential. However, in Boston, we actually locked down harder for longer than almost anywhere else in the US. We never had a mandate. Never had a mandate. New Hampshire, they had a mandate. They locked down way less than we did in Massachusetts. And so the actual behavior was driven by trust, driven by privilege, driven by a variety of things. Very little effect that's detectable in terms of the actual policies that were put in place. We also found, and these are using data from SafeGraph, what we were looking at is, this is people moving to go to church, how much further they moved on average than before pandemic measures went in place. And what ended up happening is that some states like Vermont up here, they said all the churches and all the houses of worship are open, but at 25% capacity. So if you got to hold more services, whatever you got to do, they're all open, but 25% capacity. In California, some counties, everything's closed. Other counties, everybody's open, full capacity. And so what happens is people say, okay, well, I'm going to go to church today. I want to go to a religious service today. So they Google, and we had Google searches to show this. They find a place that's open, they get in the car and they go. That's not great for epidemic transmission. You don't want people to get in the car and move around looking for their house of worship to be open. You want them to stay in their neighborhood and go to the place where they go and have the same social connections, the same mixing, but at lower percentages. And so we had a lot of this during the US, where we had these wildly inconsistent policies in kind of neighboring counties. And what ends up happening is you have people moving around looking for gyms, looking for churches, et cetera, causing more. We had this in Boston. So they opened up all the bars in Cambridge. And I was talking with the city of Somerville, and they said, well, what can we do about it? I said, well, nothing, right? I mean, everybody's just going to go to the bars and bring COVID back. So you might as well open the bars back up, because you're going to get infected anyway, then you're just going to take the economic hit. We studied this in the context of Wuhan during the early part of the pandemic. So these are data from Baidu that we scraped going from January through the end of the month in 2019 versus 2020. This y-axis is a typical thing that the tech companies do, which is, we know this is nonlinear, but we have no idea what the actual units are. So we do know from the mayor of Wuhan, they said 5 million people left the city. This is when they announced that it was going to close. So this gap right here is probably about 5 million people or so. So like what's going on here is a whole bunch of people left the city. However, they didn't all go to the same place, and they went in a way that was not predictable, at least based on any information that we had. So here we're looking at relative mobility from Wuhan to Shanghai. And this is when the cordon sanitaire was put into place. So you see this like big explosion in the number of people going from Wuhan into Shanghai. And Shanghai had a big outbreak of COVID that we think was tied to this movement of people. Nanjing is about the same size as Shanghai and about the same travel time. And we see really no strong effect of changes in mobility. So a whole bunch of people went to Shanghai, not a whole lot of people went to Nanjing. We don't have a good explanation. And this happened all over China. You can't predict where people are going to go using a gravity model if you've run into these before, where you just have the difference in the size of the cities and the travel time. That doesn't explain the travel patterns. There's clearly something else going on in terms of why people were going to certain cities and not other cities. So another answer for good data is that human behavior is hard to predict, and you just have to measure it. And so we've got to have this kind of real-time data where we're constantly measuring and monitoring. And I'll give you the punchline of the middle part of the talk, which is, I think this is how living systems work. I think living systems actually tend to be over-parameterized in reality, and the relevant parameters shift in time. Maybe the overall data generating model isn't shifting, but how it's being regularized is shifting, and the rules governing the regularization change so quickly that you never observe enough data to learn those parameters. And so instead, you have to be iteratively retraining the model, gathering data, retraining the model, making short-term projections. So another way of saying this is what happened in China is not what a lot of my physicist friends like to do, which is to just imagine we've got like a water bath and we're going to turn the temperature up a little bit and people will be bopping around more. And some of them are going to go to Shanghai and some are going to Nanjing. That is full stop not what happened. So you either have to have some much more mechanistic and detailed model of the decision-making process that was happening for these individuals in China. And I'm sure that exists, right? I'm sure if we really dug in deep, we would be able to explain a lot of this mobility pattern. But absent that, the only approach that we have is to just measure and continue to iterate. I'm going to skip over this in the interest of time, but I'll just tell you the take-home message, which is we ended up publishing what became the largest public set on incarceration in the United States. And we did this because I actually had this hypothesis as they were releasing people to bring down the population in jails and prisons, that this was going to be inequitable with respect to race. And the reason why we've been working on some sentencing reform projects is that anything involving incarceration in the United States is inequitable with respect to race. Even if people try to be equitable, they end up making it worse. However, the governors were proud of this, so it's hard to get data on race, especially like with nice granularity, so you can actually try to understand mechanism. But the governors were all proud of this. We released 10,000 people, et cetera. So they were actually releasing data for the first time. So we scraped a bunch of data, we filed a bunch of FOIAs, and what we found is that the United States had the largest decarceration in human history that happened during the pandemic. We had a 17% decrease over a very short period of time in the number of people who were incarcerated in the US. But it reversed a multi-decadal trend. So this is the percent of the population incarcerated that's Black, 41%. It's been decreasing steadily since 2013. And as all these people got released, you have this huge reversal in the percentage. And it turns out I was wrong about the mechanism. It wasn't actually the release. What ended up really causing this is that most of the decarceration was because the courts closed. So you have nobody going in, you just have people coming out. And we know that there's gross inequity with respect to sentence length by race ethnicity. So what happens is you have more white individuals coming out because they have shorter sentences for the same crimes. We estimate millions of individuals who are non-white should have come out of jails and prisons over this period if sentences were equal for the same crime. So data volume does not equal good data. We want to be able to make predictions. Some of us want to do this because we want to prevent pandemics. Some of us want to do this because depending on your particular philosophy of science, that's one way of doing science. So we've got some dengue here in Puerto Rico. I've got 3 different models that I've proposed, different mechanisms for transmission. What I've done is I've fit the model to the blue parts of the curve, that's my in sample, and then I'm testing them against the out of sample, and whichever one of these has the higher out of sample R squared, I'm going to say that's the mechanistic winner. That's not how everybody does science, but that is a way to do science. So we want to do predictions because, well, one of the things my mother she still asks is like, if you're so good at predicting flu, why don't you predict something that makes money? And I say, well, Mom, the whole point of my research, 15 years, is that we can't predict the flu very well. Like that's the whole point of the work. But some people want to make money. Some people want to prevent pandemics. Some people want to do science. Some people want to do all the above. So we really care about being able to do predictions. We know that some predictions work quite well. So this was an Ebola prediction where we've got data from July 6th through August 5th that was used to parameterize some agent-based simulation. We then have some unobserved data and then this cone of uncertainty. These are different runs of the model. The actual data is up here. And so the actual data is like inside the cone. We're a little bit under. I was on this paper, a little bit under, but this is a pretty good forecast. We're going about 4 weeks out. That's not bad. The CDC they observed over the same period, they predicted 100,000 cases, and there was only 10,000 that happened. So some predictions don't work. We've been trying to do these kind of predictions for a long time. So the earliest reference, if anyone has an earlier one, I would love to hear it. The earliest reference I can find was this 540 CE that said, during the times there was a pestilence by which the whole human race came near to be annihilated. It attacked some in the summer, others in the winter, and still others at other times of year. So they're trying to come up with what's going on here, but they're basically like, look, this is a mess. Everybody's dying. It doesn't seem to be a rhyme or reason. Then they say it divided and moved in one direction and then in the other direction. And from there it spread all over the world and always moving forward in times favorable to it. For it seemed to move by some fixed arrangement and to tarry for a specified time in each country. So going all the way back to the earliest reference, people are obsessed with this. Why are some places hit harder than others? What's the mechanistic reason? Can we make predictions about where this is going? Fast forward, there's this law that has been persistent with us that we can't shake since the 1800s called Farr's law. And Farr basically said, okay, I've got a new idea for predicting infectious diseases, which is that they're going to go up and they're going to come back down. And so this is the 1800s. We don't have computers, but we've got some understanding of now Gaussian distributions, and we can actually like model this. So we just fit a Gaussian to the upswing and we'll say it's going to be symmetric and come back down the other side. This has been applied to just about everything that has a curve. And it's been wrong. Like there's no model that's been more wrong than Farr's law. It's kind of amazing. That would be one reason to celebrate the model. So the most infamous was this paper by Bregman and Langmuir. And these people, if you're not in the public health field, these are like legends in quantitative health and surveillance. They say, okay, we got data from 1982 to 1988 in the United States on AIDS. And what we're going to do is we're going to fit Farr's law to it, and that's the dashed line. And we think AIDS over, done, 1994, not a problem anymore. Of course, we know that it's still like going. It's still a problem. It really hasn't like come down yet. Farr's law was very popular at the Institute for Health Metrics and Evaluation. And the only reason I show this is because it was popular and they were super arrogant about it, despite the fact that they kept being wrong. And then they kept being like really arrogant about being wrong. But thankfully, someone on the internet collected all of their forecasts and curated them for us so that we can go back and like really show how wrong they were. And I'm only saying this because they were jerks. It's totally okay to be wrong. I've been wrong about so many things. I had a bunch of stuff during the pandemic about how surface transmission off cardboard was super important. I have a blog post that I still have up about how mask wearing wasn't going to be important for transmission. I have a little disclaimer saying that that was clearly wrong, but I'm leaving it up because I want people to know. But you're allowed to be wrong, but like kind of like a nice person and humble, etc. You're allowed to be right, and you should also be humble. But if you want to be a jerk, sometimes we have to live with you. But we should not have to live with people who are jerks and wrong about things, right? I feel like that's like a bridge too far. So this is the real data in blue here, and I'm blue, in black. It goes up and it doesn't really ever come down. Their forecasts that we see, like you can see the Farr's law thing happening where it's like turning over and coming back down like a Gaussian. They predicted like 10 times that COVID was going to be over in 2020 and 2021. They're like, okay, next month it's over. Next month it's over. Next month it's over. Next month it's over. Part of the other reason that I show this, for two reasons. One is that Farr actually knew that Farr's law wasn't a good idea. Farr wrote about this. So Farr said the decline of the epidemic was less rapid than its rise, and the mortality was somewhat greater in the autumns. By taking the mean of the deaths in the third and fourth period, the mean of the deaths in the fourth and fifth period, et cetera, a regular series of numbers is producing. So basically, Farr is like the law of large numbers and averaging works. And if you just average enough, it'll be Gaussian. So Farr like tells you that Farr's law isn't working. But what's super interesting, and this is where I think we're actually still at today in a lot of the fields, not just in infectious disease epidemiology, but in artificial intelligence and data science more broadly. Farr believes if the latent cause of epidemics cannot be discovered, the mode by which it operates can still be investigated. The laws of its action may be determined by observation. So what Farr is saying is, maybe we can't figure out the mechanism, but we can still use statistics to make predictions. And that, like, fast forward to today, that's exactly where we are still in infectious disease epidemiology. That's where we largely are in the context of artificial intelligence and data science writ large, is this debate about, do we really need to have these like physics style mechanistic models that we use to make predictions? Or can we just get a bunch of data together and turn the crank and see what happens? So again, in the infectious disease case, there's mechanistic models going back nearly 100 years now. And this is the last part of the talk that I'll go through. So instead, Giovanni Petri and I wanted to take a different approach on this, which is, we know there's three reasons why we might not be good at prediction. We don't have the right data, we don't have the right model, or it's just not predictable. And nobody'd really come after that third piece before. We wanted to make it a little bit simpler, which is to say, can we predict this time series? This is influenza in Texas between 1930 and 1950. So all I want to know is, can we predict this time series? But I don't. The only rule of the game, I'm not going to fight with any of you about whether I have the right model. That's rule number one. Rule number two, we're not going to fight about the loss function. The closest I've ever seen to a fist fight was a computer scientist and an operations researcher fighting over the loss function we were going to use in an analysis. They were really mad at each other. And of course, in the end, we just did both, and we got the same qualitative answer with both loss functions, because that's almost always how it works. We're going to use information theoretic approaches to quantify this. So unfortunately, we're not going to be able to tell you where you have to stop forecasting. We're just going to have a relative hardness measure of the forecast. In particular, what we're going to say is, does a mechanistic model exist that we could learn from data that would out-forecast historical averaging? So there's two ways that I could do forecasting with data. I could infer the parameters of a mechanistic model and run that model into the future, or I could just sample from my data and generate the forecast via that kind of sampling. Functionally, how this works is called a permutation entropy. It's very simple in 2 dimensions. I've got a coin flip. I want to understand something about the information being generated. And so I look, and we got to pick a window size. So imagine I'm looking at neighboring. So I say, okay, I got a 0, 1, a 0, 1, a 1, 0, 1, 1, a 0, 0. I count up the number of times I see these little symbols or motifs. The flatness of this, or the Shannon entropy, is the permutation entropy. 1 minus that is the predictability. So the flatter this is, the less predictable. What that means, it doesn't mean there isn't a model generating the data. What it means is that there isn't a model that I can learn that can forecast better than historical sampling. So if it's a fair coin, I can for sure learn what p heads is, but I cannot use that to forecast any more accurately than I can use the historical data that I use to infer the model. If it's a sine wave, as soon as I get those parameters, I'm golden all the way out to infinity, and that will beat historical sampling for the data. That's the kind of thing we want to think about. In higher dimensions, like if we have a curve, all you have to think about is like the symbols become like flat, flat, up, 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 down, down, down. You could incorporate magnitude. It's still qualitative. So you could have like big up, big down. Very interesting thing. If anybody's into information theory and is a little bit more mathematically inclined, you have to pick the window size. And the way that you do this is you have all factorial possible combinations given a window size. So you have a window of length 7. You have all the ways in which you could permute 7 things that could be going up or down or flat. As you increase the window size, the entropy is going to keep going down, because you have a nonlinear growth in the number of possible symbols. There's a method that somebody published that's either completely garbage or completely brilliant, which is what they do is they say, okay, we've got 7 factorial, we've got a huge number of possible symbols. We don't observe most of those in the data. So when we calculate the entropy, we throw the zeros out of the entropy calculation. And this causes mathematicians to light their hair on fire. But it actually works because you end up with a minimum entropy as a function because of this regularization that happens. And what it means, if it's true, is that life exists in a non-integer entropy regime, which is kind of cool. But nobody's really kind of explored this more rigorously. So we just count the number of symbols and we do the same predictability calculation. One of the things that's really nice about this is a bunch of applied math people have connected this back to things like Lyapunov stability and other formal measures of predictability that we know from dynamical systems. So it turns out that while permutation entropy feels a little bit loose, it's actually very rigorously connected back to things that we understand. However, the nice thing about permutation entropy is that you can have stochasticity, that's totally fine. The models can drift, that's totally fine. Relaxes a whole bunch of the assumptions that are required to calculate any of these other measures of stability. So let's go back and let's do this. So what I'm going to do is I'm going to pretend I'm a Bayesian, and I'm just going to calculate the entropy a little bit, and then a little bit more, and then a little bit more as I see more and more data. And what's supposed to happen here? As I see more data, as I see more of my sine wave, I should become increasingly confident of the model, the true model. So here's noise, white noise. it has a real entropy. This has an actual entropy that's quite high. 1 is maximum, 0 is down here, which we don't have. Here's a sine wave. I've added a little bit of noise to the sine wave so you can see it. Otherwise, it would be way down at the bottom. What happens for influenza, 1 year of data, low entropy. As you see more data, the entropy climbs to some level that approximates noise. There's no dynamical system that does this. If you have chaotic dynamics, the entropy is high, but it's fixed. You just have to see more data before you get into that fixed entropy state. There's nothing that does this except for living systems. As you see more data, the entropy climbs. It's the reverse for all other systems that we have studied. So you might say, okay, this is influenza in Texas. Texas is weird, maybe it's not a big problem. Here are data from 50 different states sampled at different time points in terms of length of the time series. The longer the time series we see, the higher the entropy associated with that time series. And it's not just influenza. So we looked at chlamydia, dengue, gonorrhea, hep A, flu, measles, mumps, polio, whooping cough. The more data you see, the more entropy, the lower the predictability. Now, interestingly, if you stare at this, you might notice that it's like, looks a little bit separated out by pathogen type. We can predict the slopes of these curves based on the first and second moment of transmission. So the R naught, which is the first moment, and then how much variability there is, basically the effect of super spreading. That tells us almost everything that's going on between these. So chlamydia, for example, lower R naught, sexually transmitted, heavy tail distribution. So you get these big bursts of infection. It's a lot less predictable overall than something like a polio or a whooping cough or a measles that's like super regular right around its R naught. For those of you that are interested, we did this correctly from a statistical perspective, which is to pick random starting points and random endpoints and repeatedly sample. And so this is the kind of distribution around these values. And then we have the SIR model being simulated in black. And you see what happens. This is what's supposed to happen, which is like it goes up a little bit until you get to the right entropy regime, and then it's basically fixed. Whereas all the rest of these start off in regimes that are more predictable than the simple SIR model, and then they drop dramatically into this realm of unpredictability. And we think what's going on here is that this is biology at work. You have a vaccine, you have evolution of resistance, you have people masking, they stop masking, and the physicists say, okay, yeah, but this is not really fair. It's a different process. It's still the same underlying model. It's just different parameters being turned off and on. Fine, that's fair. But you never see enough data from any stable set of parameters to actually infer what those are, and then use that to forecast out into the future. So what we're finding is that with real-time high-resolution data, we can predict epidemics, but only a few weeks out, 4, 5, 6 weeks out, and then there's going to be a hard boundary beyond which you can't do any better than just historical averaging. So this is work that is inspired part of a new large CDC consortium grant that Professor Alessandro Vespignani is leading and has partners all over the United States called EpiStorm. So what's the path forward? I think we have to invest more in combination of people, process, and technology. I think that's part of the reason why what you all are doing here at the Lucy Institute matters so much, because you got to have all three of these things going together if you're going to be able to generate this kind of real-time actionable data that's tied to policy, that's understanding mechanism, that's integrated into both our scientific processes and our processes that are having, positive social impact. And there's no way to separate out any of these things from each other. You got to have everything under the same roof. That is hard and it's expensive. It requires leadership and dedication, but there's no way around it. And then I think we have to, in the public health space, and this is a very nice op-ed, came out in 2021 in the Boston Globe, about taking this people process technology to its natural conclusion in the context of public health, is that we need to have this new field of public health technology that's embracing all of these different kinds of models and data modalities, that's embracing technology-driven approaches to health. And so without sustained investment in good public health data and tech, and that has to include education and workforce development, we have little chance of preventing pandemics, the effects of climate change, reducing inequities, et cetera. So the take-home message is good data are a key ingredient for advancing precision medicine, public health, climate change. The tech companies know this. It's all about the data. It's all about the data. They just lie to people when they say that, you know, they have an A to B solution that's all in silico. And I think we need to acknowledge that up front. Good data requires technology and sustained investment. There's no way around that as far as we know right now. COVID-19, together with past and ongoing epidemics, has revealed the importance of this good data. So there's no more excuse anymore. I think up until COVID, there was still a lot of active and meaningful debates about where the actual problems were. And I think it's been very clearly demonstrated at COVID that with good data, you can identify the inequities, you can identify remediation methods, you can identify interventions that will work. You have to do them. There's still that policy gap that has to be bridged. And I think taking together, at least in the context of public health, this sort of demands a new field of public health technology that embraces this and trains people to think like how all of you are being trained to think. But a lot of what we're doing here has not yet made its way into mainstream public health, into government. It's made it into some businesses. But again, that's part of why what we're doing as educators inside of the university is so important, because we can train that next generation of decision makers. We can work on workforce development. We can be a part of entrepreneurial efforts that bring some of these things out into the public spaces with new sorts of funding models, et cetera. The last thing that I'll mention, and this is the most important part of the talk, I attribute this quote to Peter Dodds at the University of Vermont. But Peter always says one of the biggest problems with scientists is that we don't understand that if you actually want to impact policy and people's lives, that bringing statistics to a story fight is going to fail. And that you've got to have the numbers and the data and the models to back up what you're doing. But ultimately, if you're going to win the hearts and minds and influence policy, you have to tell the story. And that's a big piece of the communication part. I didn't talk very much about this, but how we communicate the uncertainty, how we demonstrate the right level of confidence while acknowledging the things that we don't know, how we have iterative processes with people as we update our knowledge. All of these things are areas where tech companies and others have gotten very good, and we have a lot of room for improvement on the academic side. So thank you again for having me. It's been a real pleasure. Happy to take questions in the remaining time, and thanks again.